Okay, we're going to do skill 2.29, administering nasal medications to your patient, okay? The first thing you're going to do is you're going to check your medication order. You're going to make sure that they have a medication that is ordered and it is appropriate, okay? The next thing you're going to do is you're going to gather meds from the medication room. Okay, so some facilities you have to actually go to a medication room and get the meds for your patient, and then bring them to your patient's room. You are never, ever going to administer medications when they are in the community room, like at a long-term care facility, okay? You really should be taking them to their room and giving them their medications, okay? So you've gathered the meds from the medication room, and then you're going to take them to your patient's room. First thing you're going to do is you're going to check the medication label 3 times for safety, okay? 1 when it was taken from the medication drawer, okay? You're going to then you're going to take the medication, okay? You're going to look at it and say, yep, this is the correct med, okay? You're going to look at the expiration date on it. Make sure it's not expired, okay? Make sure it's the right medication, okay? You're going to compare it to the MAR. You're literally going to take the MAR, okay, if it's on a paper, and you're going to look at the paper, you're going to look at the med, and you're going to go, yep, yep, yep. Right dose, right route, right strength, okay? You're going to do all that, okay? And then you're going to compare it to the MAR in the client's room or when you're ready to leave the medication preparation area. Those are the three ways of looking at the med before you even get to the patient, okay? And then you're going to prepare the correct amount of medication without contaminating it. Generally, your nasal sprays are going to come completely ready in a spray, ready to go, so you don't have to prepare it, okay? And then you're going to perform WIPSA, okay? Now, when you're giving a patient a medication, they are entitled to rights, okay? And there are 6 rights. You have to make sure that you have the right individual. You have to make sure you have the right medication, the right dose of the medication, the right time, the right route, and the right documentation. So you need to make sure that when you are completed with your medication administration that you document it correctly, okay? All right. Then you go to your patient and you are going to assess that you have the correct patient. How do you do that? You use 2 patient identifiers. That's going to be their name and their date of birth. It's always, hello, my name is Kathy. I am a nursing student with Alfred State, and I am going to be taking care of you today. Right at this moment, I have to give you a medication. So you're going to look at their band on their wrist, okay, and you're going to say to them, while looking at the band, could you please tell me your name, and have them state to you their name. And it must match what's on their wristband, okay? The other thing you're going to ask is, what is your date of birth? That will also be on the wristband. So they should be able to tell you their name and date of birth. That is two patient identifiers, okay? All right. The other thing that you're going to be looking for are allergies. Do they have any allergies that you should be concerned with, especially since you're going to be giving a medication? You're always going to assess allergies. Every patient, every time. Okay? All right. So, tell me your name. Could you tell me your date of birth? And do you have any allergies? Let them answer you. Okay? That way you make sure that you have the right patient. All right? I'm going to turn this. I feel like I'm out of... There we go. Okay. So then... you're going to assist the client into a comfortable position. If you're giving a nasal spray, having a client lying down straight on the bed is not going to be very beneficial for the patient, okay? So you want to have them sitting up in bed, okay? And then what you're going to do is you're going to unscrew the top, okay? And it's going to look like this, Okay, this is what a nasal spray looks like. Can you see that hole in the top? That's where the spray comes through, okay? And what you're going to do is you're just going to squeeze it like this, okay? And I don't know if you saw that fine mist come up, okay? And that's what's going to go up inside of their nose, okay? So you're going to assist the client into a comfortable position. You're going to hold the tip of the dropper just above the nostril and direct the solution laterally toward the midline of the superior concha of the ethmoid bone. And you're going, what? Okay, it's going to go right here. Going to go right here on this little thing right here in your nose, okay? You're going to spray it towards the middle of the nose, okay? Excuse me for showing you my nostril, but I had to show you, right? Okay. And while you're administering this, you want to tell your patient that they are going to be breathing in through their, so that you can inhale that medication, okay? All right. So you're going to plug one side of their nostril. You're going to put this in their nose. I'm not going to do it, all right? Or by it, and you're going to squeeze one time. That mist is going to go up inside their nostril. Have them breathe in again. Get it up in there. Pinch, spray, okay? They're going to want to blow their nose immediately. Don't let them do that. Let them keep breathing that medicine in, okay? You can give them a tissue. Now, some of you are saying, oh my, she doesn't have gloves on. Well, first of all, it's my nose. And second of all, if you really want to put them on because you're dealing with mucus and you may get in contact with something you don't want to, you can put gloves on, okay? I'm not saying you can't. You're going to discard a dropper if you were using a dropper, but for this, you're just going to make sure that you clean off the tip with an alcohol pad. Put the cap back away on, and replace the med to the holding area for the medication. You're going to remove the gloves if you put them on and perform hand hygiene, and you're going to document the medication on the MAR in the client's record, including assessment findings, okay? So that is Skill 229, Administering Nasal Medications.